Starting therapy can feel like stepping into the unknown. You're meeting a stranger and opening up about your deepest thoughts and fears. It's quite nerve-wracking, right? But today, I'm going to break down everything you need to know to turn that anxiety into confidence so you can start healing and growing from day one. Let's dive in. Hi, my name is Daniela Moore, and I'm a licensed professional counselor. Recognizing that you need therapy is a proactive and powerful step toward better mental health and well-being. But I get it. Navigating the mental health care system, finding the right therapist, and getting started can feel very overwhelming. That's where I come in. I'm here to guide you through this process step by step. With the right knowledge and a clear understanding of what to expect, you can approach your therapy journey with confidence. Therapy is not just for the tough times. It can help you manage stress, strengthen relationships, understand your emotions, boost self-esteem, heal from trauma, and develop coping strategies for life's challenges. In fact, therapy can be beneficial for anyone at any stage of life. There are many types of therapy out there, and each of them offering its own unique approach and techniques. And the key in finding the right one for you lies in understanding your specific needs and goals. To help you get started, here's a quick rundown of the most common types. Cognitive behavioral therapy, or CBT, focuses on identifying and changing negative thought patterns and behaviors. Since our thoughts, feelings, and actions are all interconnected, altering negative thinking can significantly improve emotional well-being, making CBT highly effective for treating anxiety and depression. Psychodynamic therapy delves into past experiences and unconscious processes to understand current behavior and emotional challenges. By exploring unresolved conflicts and deep-seated emotions, psychodynamic therapy helps you uncover how your past influences your present relationships and actions. Humanistic therapy emphasizes personal growth and self-actualization, fostering a supportive environment where you can explore your feelings and work towards achieving your full potential. Dialectical behavior therapy, or DBT, was originally developed for treating borderline personality disorder. DBT combines cognitive behavioral techniques with mindfulness practices. It's designed to help manage intense emotions, enhance present moment awareness, build resilience, and improve communication and relationships. And acceptance and commitment therapy, also known as ACT, uses acceptance and mindfulness strategies alongside commitment and behavior change techniques. Instead of battling with your thoughts and feelings, ACT encourages you to accept them while living in alignment with your values and taking meaningful steps forward, even in the face of difficult emotions. It's very common for therapists to blend these approaches, tailoring their methods to offer the unique benefits of each, depending on what will best support your journey. Please give this video a thumbs up if it's adding value to you, and consider subscribing to my channel where we dive deep into the world of mental health and personal growth. Finding the right therapist can feel a little overwhelming, but don't worry, there are plenty of resources to make this process easier. Start by asking friends or family for recommendations. You can also explore online directories like psychologytoday.com, which allow you to search for therapists based on location, specialties, and more. Another good option is to check with your insurance provider for a list of covered therapists in your area. Check out the description down below for some helpful resources, and if you have any questions, drop them in the comments. When choosing a therapist, keep some key factors in mind: their specialization, credentials, therapeutic approach, and experience. If finances are a concern, it's also important to check whether they accept your insurance or offer a sliding scale for fees. But above all, make sure you feel comfortable with them. Building a strong therapeutic relationship is crucial for your progress. As you search for a therapist, or after you have found one, take some time to think about what you want to achieve in therapy. Whether your goal is to manage symptoms, gain deeper understanding, or improve relationships, having a clear focus will help guide the process. Your therapist will work with you to create a plan tailored to these goals. Therapy is very much a collaborative effort. Many therapists offer a free 10 to 15-minute initial consultation, which is a great opportunity to make that first connection before fully committing. Use this time to share your concerns and see if you feel comfortable with them. Remember, therapy requires a commitment of both time and effort. Be prepared to attend sessions regularly and actively participate in the process so you can get the most out of your journey. Your first therapy session can be nerve-wracking. I get it. You're meeting this complete stranger and you're expected to share things with them that you might have not shared with anyone else before. Trust and comfort take time to build, but knowing what to expect can help ease that initial anxiety. During the session, your therapist will ask you several questions as part of the intake or assessment process. You'll discuss why you're seeking therapy, your personal and family history, and your goals. Your therapist will also explain their approach and answer any questions you might have. This session is all about getting to know each other and see if it's a good fit. Therapy is a journey and progress does not happen overnight. In ongoing sessions, you're going to work on the goals you've set, dive into your thoughts and feelings, and develop strategies to cope with the challenges that you present. It's important to be patient with yourself and open to the process. Remember, therapy is a collaborative process. If something isn't working, you need to let your therapist know. We cannot read your mind. Communication is key in any relationship. While therapy is a vital part of your mental health journey, don't forget the importance of self-care and support systems. Engage in activities that bring you joy, maintain a healthy lifestyle, and lean on your friends and family for support. Oh, and one more thing. Most of what you share with your therapist is strictly confidential. Legally, we cannot disclose anything you say or we risk losing our license. You can be honest with us. Click or tap here to learn what you should not tell your therapist. Remember to like, share, and subscribe. Leave me a comment below. Thank you for watching. I'll see you in the next video as we continue to evolve more.